awesome. You be first.
Yeah. Congratulations, you got accepted.
Awesome. That means I probably got in too. Oh no.
What do you mean?
I didn't get in.
I don't understand.
I don't understand either. We had the same GPA and everything.
Yeah, we've been through all of this together, all the same classes and everything.
What am I gonna do? I'm going to talk to the dean about this. This makes no sense at all.
Come in.
Hey, Dean Morris.
Hey, Mr. McElvin, I see you're making your appointment right on time. What can I help you with today?
Well, I received this letter in the mail, and I was expecting an acceptance letter from y'all, but I got declined, and I would really like an explanation as to why I got declined, because I felt that I should have got accepted.
Yeah, well, I've pulled some of your records, and maybe I can tell you go over a couple things, maybe as to why you didn't get accepted this semester.
Okay, that would be great.
Okay. Well, first of all, I noted that your GPA looks great.
Yeah, it looks really good.
And your test scores seem to be above average.
I thought I'd beat everybody in the class.
And your interview with me went well.
Mm-hmm.
And all your records were clean pertaining to your background check.
Of course. Okay.
Everything appears to be all lined up, and you should have been accepted. Let me discuss with you some of the underlying reasons that might have played a role in you not getting accepted this semester.
All right, that would be great.
First off, there's usually about 500 applicants, and we only have about 60 seats, which makes it extremely competitive to get in.
60 seats? Well, why don't y'all have more seats than 60 seats?
Well, we only have so many nurse educators to staff the nursing programs.
Well, why don't y'all just get more nursing educators?
Because there are not enough practicing nurses that are willing to come back and teach because of the requirements that they have to meet.
Wow. Okay, well, I guess I'll just have to be happy with that explanation, but oh well, I guess I'll just see you next year.
Yeah, good luck. Great talking to you, Mr. McElvin. You have a great day.
Thank you, I'll be around.
Yep.
I just thought for sure that I would get into the program. I guess hard work doesn't always pay off.
Hi, my name is Catherine Morse, and this is my partner.
Drew McElvin.
And today we're going to tell you a little bit about the challenges in nursing education. The reason why we feel this topic is of importance is clearly because our education directly affects our future. You see, before you decide a career path, you mentally assess the pros and cons of each career path that interests you.
We obviously chose nursing, but despite the positive things that we have heard from everyone pertaining to the job security and excellent educational opportunities, we may have discovered a flaw in the process that could weigh heavily on our future.
In the field of nursing, nurses are faced with many different challenges each day. These challenges can range from patient-related to coworker-related and many more. Although nurses do have to face and overcome challenges each and every day, the hospital themselves are facing a giant challenge.
The challenge that they are facing is a shortage of nurses in the workplace. Though many believe this shortage is the hospital's fault, it is easy to see that this is not the case, and that there are bigger, more serious reasons as to why the shortage has occurred.
To look at the reasons why this issue is a challenge for hospitals, one must first understand how this is a challenge to the nursing profession and also to healthcare.
According to Sela, Twibble, and Keller, quote, "A severe shortage of nurses exists nationwide, putting the safe, effective health care of Americans in jeopardy," end quote. Because this statement is true, it is easy to see why this issue is such a challenge. The shortage of nurses puts more weight on the shoulders of nurses in the workplace, therefore putting the patient's health care in jeopardy.
After looking at how the shortage of nurses affects the nursing profession and healthcare, one must look at the reasons behind the shortage. The first and most important reason for the shortage is the lack of faculty and nurse educators. In their research, Sela, Twibble, and Keller found that, quote, "The lack of faculty restricts nursing program enrollments," end quote. This means that because the number of nurse educators is low, nursing programs are having to limit the number of people that they accept for the program.
Nardi and Gayurko say that, quote, over 75,000 qualified applicants to nursing programs in the United States alone are turned away each year because of the lack of nurse faculty, clinical sites, and inadequate education budgets, end quote. From these statements by the researchers, it is easy to see why the lack of nurse educators is the biggest contributor to the lack of nurses in the hospital.
Following the idea of the lack of nurse educators in the program, the lack of students in the program is also a big issue that the nursing program is having to deal with. Although this issue comes directly from the lack of nurse educators, it is still important that the issue is not overlooked. The reason this issue should not be overlooked is because if nursing programs continue down this path, they will never be able to meet the demand the hospital has for nurses.
Sela, Twibble, and Keller comment on this issue, saying that, quote, the faculty shortage must be resolved in order to admit and graduate the number of nursing students needed to address the nursing shortage, end quote. From this statement, one can see why this issue is important, and that if the nursing shortage is not addressed soon, there will be a demand so great that nursing programs will not be able to meet. There is no doubt that it is important for one to look at what is causing the nursing shortage, but it is also important to search for ways to resolve the problem. One way of resolving the issue is by hiring more instructors and nursing educators into the programs of the college or program so they can financially support the extra help.
Continuing on with the idea of overcoming the nursing demand, another way to help the issue is by accepting more qualified applicants into the program. More times than not, colleges and nursing programs only accept a certain amount of applicants at a time. By increasing the number of applicants into the nursing programs, colleges and universities will be able to increase the number of nurses that they can graduate.
An increased number of graduates will, in effect, create an increased number of qualified nursing personnel for the hospitals. Another way to help meet the nursing demand would be to make the nursing profession a more appealing career path to choose. A lot of intelligent, qualified people may have the wrong impression of what a nurse's responsibilities are and may not fully understand the advantages of what being a nurse entails. Making the career more appealing would create a greater demand for colleges to increase nursing educators, which would increase the amount of nursing students, which then would increase the qualified professional staff nursing personnel for all hospitals.
Once nurses have completed the program, it is important that they are helped by the program they attend and graduated from with getting a job. Tamara Dolan says that, quote, within 6 months, most of our new graduates are employed full or part-time where they want to be working, end quote. The reason Dolan and her colleagues are able to get the nurses jobs so quickly is because they want to see their nurses succeed, and getting them into a workplace quickly is the best way to do so.
The last and final way to help meet the demand for nurse and nurse educators is by allowing older nurses to work part-time and teach in nursing programs part-time. When doing this, nurses in the program are able to learn from other nurses that have been in the profession, and these nurses are able to better prepare the nursing students for what is to come.
This also helps with professional nurse involvement because they're able to come back and work hands-on in the nursing program. After looking at the nursing demand issue, it's easy to see that this is a problem that needs to be solved as soon as possible. Whether it be hiring more faculty or accepting more students, colleges and nursing programs need to work together to get this issue resolved. When this is done, nursing programs will meet the demands for nurses and also see the profession of nursing begin to grow.
In conclusion, we feel that these issues are in dire need of attention and need to be looked at as a serious problem. If these educational problems are not fixed in the near future, then the long-term effects that it could have on the nursing career could be lethal. We as nursing students need to focus on ways to improve and help grow our future profession.
Will the profession be a strong and extremely sought-after career when our time comes to retire in 40 years?
Only time will tell, but a strong profession starts with us.
Let's get the ball rolling!